Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned gynecologist and obstetrician, a gold medalist in MBBS, and who retired as a professor, head of the Department of Obstetrics Gynecology in Bangalore Medical College, and now she's working in Chinmaya. And she is always concerned about the society and the bringing the awareness among the society. So she has written many books and also articles to bring the awareness among the public. Today she is going to tell us how a woman who has become pregnant before delivery, what are the precautions she has to take, and what are the treatment that are available, and what precaution. Welcome, Dr. Sunanda.
Namaskara. Thanks for the
Yeah,
opportunity.
yeah,
Uh,
yeah.
First, I
Now,
would like
yeah. First, I would like to ask you the question: what are the treatment? What are the vaccinations that she has to take before delivery? And then we'll go to the food that she has to take. Okay.
so during pregnancy, we give vaccination. So it
Mm,
protects not only vaccines, they protect mother and they
mm,
protect the baby also.
mm.
And some of the vaccines they protect even doctor also because if you go on, for example, COVID. See, doctors also fall ill. So not all vaccinations, some of them. Okay. So now during pregnancy, all these days we are giving tetanus toxide, but
Hmm,
nowadays we are giving TD in government
hmm,
hospital. TD to two injections are given. But if they can afford, we are giving TDAP also between 27 to 36 weeks. So with
hmm,
a baby when it is born,
hmm,
it gets the antibodies from the mother, and
hmm,
up to 6 weeks, it will be there.
hmm.
Antibodies will be there, but still some cases they have seen pertussis and this not tetanus, pertussis and diphtheria, all that.
Diphtheria.
So diphtheria. So nowadays we are giving Tdap, TD, and all that. Now this is about the vaccination. Now
Hmm,
in case of emergency also, so we can give some vaccination like yellow fever. If she is going to Africa and all that, we can give yellow fever. And
hmm,
if she is bitten by a dog, you can give rabies. But normally it is not given.
hmm.
Only if there
With
is
the
an
need of
emergency,
first. Yeah.
only in those cases we give.
Hmm,
And some of the vaccination we should not give during pregnancy. So that one need not worry. And during pregnancy, vitamin D also should be in good quantity. So the vaccines which we give will be more effective. So
okay.
but, we
And
prescribe tab.
apart from this, in the first trimester, even before she conceives or after conceiving, folic acid is a must. And that folic acid you have insisted last time also, and now also you are telling. And most
Yeah.
of the ladies, when they become pregnant, no, they have the morning sickness and the nausea, vomiting. So tell us about that and what precautions they have to take and how to treat it.
This vomiting could be one is it may be due to pregnancy only.
Hmm.
Apart from pregnancy, it may be due to something else like pylori infections, or they
Hmm.
might have eaten
Food
some in
infection.
outside,
Hmm.
some infections. Sometimes they may have migraine. For that
Hmm.
also they may vomit. Or if they are traveling, it might be due to motion sickness.
Hmm.
Some maybe other reasons. But we have to
Hmm.
confirm that it is due to pregnancy only. And it is more when there is a pregnancy, the mole pregnancy or multiple pregnancy, it may be more. And it is genetic also.
Hmm.
And then in multiple pregnancy nowadays in ART, because of the ART, we are getting multiple pregnancies more. So there also
Hmm.
it will be more. Now, if it is not treated, this vomiting, it may
Hmm.
lead to weight loss. And whatever sugar or whatever she is eating, that it should go to the baby for the development of the baby. Instead of that,
Hmm.
she herself suffers. So she will be
Yeah.
starving.
Hmm.
And then there will be dehydration.
And
And then
hypertension. BP will be
hypertension,
less
and
and
if it
start feeling
continues,
giddy and all that.
yeah, yeah.
Yeah.
Then if it is hyperemesis, then
Hmm.
she has to be admitted. Now, when
Hmm.
to go to the doctor?
Hmm.
See, if you are solid food you are eating and you are vomiting, even
Hmm.
liquid food you are vomiting, even water you are to drink you are vomiting, then you should go to the doctor. So
Hmm.
solid food you are eating, you may vomit, but some
Hmm.
part remains behind. But
Okay.
when you are vomiting, even with water,
Hmm.
liquids, then you should
Hmm.
go to the water, to the
Hmm.
doctor.
The doctor.
So there, and then what are the remedies at home?
Hmm.
What you can
Hmm.
do?
Hmm.
So in at home, what you can do is you should make this sharbat, nimbu sharbat. Okay, so put sugar. and then you can
Or
put
jaggery. Instead of sugar,
ja-
jaggery
jaggery
and
and this
jeera,
ginger.
jeera, jeera and
Not
ginger.
a jeera,
Okay.
ginger. Ginger and jaggery paste.
Hmm. Hmm.
That they should take because it is proved.
Hmm.
So cancer patients are also nowadays taking this ginger and jaggery paste.
Jaggery.
So that they can take at home, and then sharbat they can take, and this tender coconut that she can
Water.
take. So she should take a plenty of fluid. And
Hmm.
see what food she should take during
Hmm.
this time. See, one need not force her husbands and a mother-in-law or mother. They may force her eat rasam sambar. No, see, something should go in her stomach. So
Let her eat what she
she can eat
wants.
varieties of nuts she can eat, and then the puff rice, say without this oil she can take, dates she can take, and then a rusk she can take. So what with this, if her stomach is full,
No,
that is enough.
when you're talking about what she has to eat, I remember 46 years back when I was doing my post graduation, I became pregnant. I would take only one apple and then one buttermilk. That's all. I whole day I used to live with buttermilk only or
Mhm.
water. And that's how one each one can decide what is suitable for them and how they can eat. Yeah.
Some people vomit, even they vomit blood. We
Oh,
ask them to
oh,
eat ice cream also. Some people
okay,
vomit it till the end. So it
okay.
might be due to some other reason. And then,
Hmm.
that's why they should take
Okay.
plenty of fluid in different forms.
Hmm.
And then the
And
next,
but most of the time, when they don't eat well or the eating habits are changed during the pregnancy, they invariably become constipated. And that constipation can lead to fissure or hemorrhoids, and they can bleed and become anemic. So, how do they prevent it? Please tell us about constipation, why
yes,
it
this,
occurs.
yeah, during pregnancy, constipations, not all, some will
Hmm,
have, some get the
hmm,
constipation. It might be due to
hmm,
it might be due to change of taste also, because
hmm,
during pregnancy they can't eat whatever they were eating all these days. And
hmm,
then in pregnancy there is vomiting, so no fluid is also less in their body. And
hmm,
apart from that, the hormone which is produced by the placenta, named as progesterone, that relaxes the bowel, and
hmm,
because of that they may have constipation. And growing uterus, that is in the first few 3 months, it is due to vomiting, so
hmm,
dehydration, that can cause constipation. And
hmm,
after 3 months, when the uterus starts growing, it produces
hmm,
pressure, it impacts on the large bowel, that can cause
hmm,
constipation. And then next is we give them iron capsules during
hmm.
pregnancy,
And
that
that also
itself can
causes
cause
constipation.
constipation.
Yes,
So
yes.
there are many reasons.
Hmm,
So what household remedies, before coming to the doctor, they should try there are some household remedies. They should take a lot of fluid first,
hmm,
at least to 1.5 to 3 liters. They should 2 to 3 liters. They should take.
hmm,
Then constipation may be relieved in some. But otherwise, they should take the food containing fibers.
hmm,
So they can eat the big bananas. I always they say big bananas. So
hmm.
bananas, it contains fructose. If they don't eat, that also it serves the purpose. That's they
It gives
should
a
take
nutrition also.
nutrition
And the
also.
banana, as you say, it is three in one. It contains serotonin, antidepressant. It contains laxative, so constipation is relieved.
Yeah.
It contains pectin. It relieves the gastritis also. So
Mm.
banana is good. One glass of milk and banana at night, and
Mm.
constipation can be
Yeah.
relieved.
And they
Okay.
also take buttermilk
Yes.
with the salt, buttermilk,
Yes.
and it contains yogurt. That's a probiotic.
Lactobacilli probiotic. Yes.
So and then in at villages they give this jawar,
Hmm.
and jawar roti, which contains a
So
husk
any
kind.
millets can be taken
Millets
because they
also.
contain plenty of fibers. Yeah,
And the fenugreek and water
yeah.
they can
Hmm.
take.
Hmm.
And the what else? Ragi also they can take. Hmm. So all this you said, and then gava fruit, it contains large
Guava
amount.
fruit,
Yeah,
vitamin C
gava.
as well
Yeah.
as thing.
Yeah.
Yeah.
That
And now
they,
when a lady
and
becomes
papaya also they
pregnant,
can take. Papaya.
but many people think that papaya is. Think some people have the fear about it, but
No, say
banana
it's
is the must. The other
now
fruits they
now
can.
in
Yeah.
North India. North India, when somebody becomes pregnant, they give papaya fruit.
Okay.
Only in South India, we think papaya is,
Will
but
cause the
kacha
abortion. Yeah,
papaya,
yeah, yeah.
unripe papaya is,
Mm.
it's not good. Ripe
Okay,
papaya is
right
good.
papaya.
Papaya is,
Okay. And
is
when a lady has become pregnant, the whole family members are very cautious. So they keep on telling, don't do that, don't do this, don't lift that, don't walk, don't think. But then, I delivered on duty, and that is the reason I'm telling better to lead. So, what do you say about it? How do they
see, they
travel?
can do
How should they
all
wear the
routine work.
clothes? Yeah, yes.
They can do all routine work what they were doing previously.
Okay.
I have seen like you, one of my friend who was pregnant in
Mm,
Hubli.
mm,
When she was delivering a patient, then she
mm.
got the pain. Immediately she went and slept in. Now she is in UK. She slept on the
Okay.
next labor cot. So till then she was doing duty. She delivered a baby immediately
Yeah.
before placenta came. She had a pain, severe pain. So she went and slept on the labor
That is
cot.
really good one, because I did the emergency duty till 1:30 and delivered at night 9:30 the same day. But she is better than me. What about the clothes? What sort of clothes? That nowadays people are
Clothes,
wearing very
clothes,
tight ones and all that. Yeah.
clothes and travel both I will tell. Clothes,
Mm,
anything which is tightens around the waist they should not wear. So they can
mm.
wear sari, but it should be the above the they should tie above
Uterus.
the uterus,
Uterus.
or they can tie below and put the pallu so that no one can see
Okay.
the
Yeah.
tummy. And then
Or wear a gown.
or they wear a gown. But
Okay.
that is about the sari. They should not
Mm,
wear the high-heeled shoes. They should wear the flat slippers. And
mm,
if they are traveling, now I forgot to tell one more reason. If they are
mm.
traveling, that motion sickness and all that also, they may get vomiting while vomiting. And then
And also urinary tract infection, they must be very careful, because if in the third trimester, if they get urinary tract infection, it can go into the fetus also.
premature
So I
labor.
have seen.
Oh,
Yeah.
premature.
So
Even
whenever
in
they
first
are
trimester
traveling,
also.
the cleanliness has to be maintained, and whatever they are using, it should be very clean. Okay.
Okay. Uh, this one, while
So,
traveling, if they are going in plane, that
hmm,
seat belt,
hmm,
it should
hmm,
be above
hmm,
or below
below,
the
and
seat belt
not
also.
around the, yeah.
Not
Okay.
around the
Okay.
waist. See, this is
Okay.
about their traveling, but
And
while
some people have delivered in the flight also and in the train
no,
also.
see,
And
nowadays
I remember a lady, she felt like going to motion. She went, and then, she delivered in the toilet only in the train, and the baby fell down. And nowadays, now it is better, we don't have that sort of toilets. And
no,
anyway, one has to be very careful when they are traveling.
no. So see, now there are rules now. Each
Hmm.
airline has its own rules. Up to
Hmm.
32 weeks they will take, up to 34 weeks they will take
Hmm. Hmm.
the passengers. So there are
Hmm.
rules now. So
Hmm.
sometimes they ask certificate also if they are pregnant.
Okay. Okay.
So and
Okay.
then we always tell from
Hmm.
14 weeks,
Hmm.
14 weeks to 28 weeks it is better they can travel.
Hmm. Hmm.
Easy, they can travel. After
Yeah.
28 weeks, they should think whether it is necessary to travel,
Yeah.
and then is it essential,
Hmm.
and then they should take carry medicine, and then
Hmm.
water they have to be careful. They should not
Hmm.
go and eat ice cream or something outside, and then
Yeah. Pani
the
puri, bhel puri, and
yeah,
all
yeah,
that.
all that whatever that they
Okay.
should take care of.
So Sunanda, thank you very much. You have so humorously, so nicely, you have told how women have to be careful when they are pregnant, and so that they can have a safe delivery, and mother and baby can be very safe. Thank you very much. Thank you.
Thank you.